So welcome. I'm Lorna Taylor. I'm a children's physio by profession, but then specialised latterly in occupational health and ergonomics. I've got a real interest in preventative illness and health promotion, and I was working in schools for the last 10 years now, looking at low-level working. I primarily went in looking at back care for children because we're seeing more and more children coming through with back and neck problems, so much so that you're not able to see them in individual caseloads, physio caseloads. So they're looking up at back pain schools for children after school. So it's a bit of a growing issue, and I think after lockdown learning in terms of ergonomics at home, we may be familiar a bit more so with our own children or children we know. So it's starting to get gain a bit more momentum in terms of musculoskeletal health and well-being in children. But primarily I have been working with the educators and low height working for the last several years. So, won't read, but quickly look at ergonomic factors related to the education sector. There's a lot more interventions coming through in this country and in Europe. I'm a UK ambassador for an organisation called ENITOSH, which is like a European network for training in occupational safety and health in schools and universities. So their big push in terms of an EU-wide intervention and further afield is that although there's lots of initiatives in the workplace looking at musculoskeletal health and our manual handling, actually there's very little on in education curriculums. So it's looking again at that preventative health because these young people will be the future workforce. So they're looking at trying to tackle it a little bit earlier in terms of risk, manual handling, ergonomics, asbestos awareness. And certainly as education moves a bit more towards apprenticeships and children are entering the workplace essentially at a younger age. So we'll recap a little bit about on that, things that are happening further afield, and primarily what can help you in your practice. So we should finish a little bit sooner in that we can have some discussion, and I also recognise it's the afternoon of day 2, so we'll whiz through. I think you'll get handouts, and anyone is more than welcome to email me if you want slides after, but I think they're going to be in your pack. So in terms of if we think about the children first, and then we'll look at the educators. Are you generally supporting educators as a show of hands in terms of, yeah. And so if we focus more on them, but then add the children in terms of interest, does that sound okay? And also if you are working with educators and schools and you have the opportunity to share improved practice, then that would be phenomenal. So we'll briefly start on the children and then we'll move more to the educators. So the new way of thinking really of musculoskeletal health and well-being is in terms of a life course approach to musculoskeletal disorders. So again, it's not just picking them up when people have acquired them in the workplace. Even young people going into schools at a later date working, trying to get them earlier. And these primarily come into these categories we've got here, and a big one is physical activity. And in terms of children are later to walk now, so in terms of delayed development, children used to be walking about 18 months. Generally now it's accepted that 2 years is okay because children aren't really getting as much tummy time. There's all these contraptions which brilliantly keep them safe from the car seat to the car to home. So they're just not moving as much. So developmentally, gross motor-wise, they're not as physically developed as they were. And that also leads into their risk awareness. So if they're not moving and trying to reach that toy and learning about their bodies and movement, they are less able to have that motivation of wanting to move and assess their own risk. So that can then feed into potential safety concerns later on. So physical activity is really important in terms of green spaces and getting out with families, and physical activity provision in the community. So all the sort of healthy well-being aspects of diet, moving, mental health, smoking, all feed into these helping to prevent MSDs in children and adults. One of the interesting ones, I think, we'll pull out just a few of them, is diet. So in terms of our bone bank, it's by about 30, we've built up our bone bank, and after that we start drawing from it in terms of osteoporosis and such like. So actually something I think that's going to come is vitamin D and calcium nutrition in our young people, certainly in terms of lockdown when a lot of people have been home a lot of the time. So I would urge you, if any of you have got young people, just making sure that their vitamin D, they're getting adequate vitamin D in their diet while this bone bank is building up, because musculoskeletally, they're potentially more prone to fractures later on. We know about the psychosocial factors influencing our physical health. And sleep, that's another thing in young people that we really need to consider and address, that they are getting enough quality sleep. Smoking, research I'll come on to in a minute, looks that children that do smoke have a far higher risk of musculoskeletal injuries and fractures in later life. So coming on to ergonomics, that's also feed through into staff, looking more so at environmental ergonomics. So actually the temperature, the light, the ventilation, we're a bit more familiar with the ventilation now. So noise, they can all impact our posture and our health and our musculoskeletal well-being in the classroom and when we're home learning. We're more familiar with school bags and seating and such like. Technology use has obviously increased rapidly, but there's not really any education per se about how young people use that equipment, but there is some we'll come on to. So knowledge and training, I think, is a huge part, because I'm not aware how many schools are familiar with all these multifaceted aspects of musculoskeletal health and well-being, A, for the children, or secondly, more importantly, for themselves. So it's looking at, can we get this sort of thing on teacher training programs? If you've got a decent school leader or any leader that prioritizes well-being, you've got a better chance. So some of the schools that you might be working on might be more receptive to preventative health ideas. So if we think a little bit about the teachers, again, the leadership is key, and I'm sure you'll work with some schools that you know are ready to embrace the information you wish to share, either reactively if people have got issues or more preventatively. There is legislation we're aware of, but that doesn't always feed through as much as it should do. Looking at management, prevention we know is by far the best route to go in terms of cost effectiveness and effectiveness of actually the intervention on the person we're trying to help. The psychosocial factors are enormous, aren't they, at the moment? Everyone does seem to be under such pressure, and we know the direct correlation between our physical and our mental health. Sleep, bone hydration. So this healthy lifestyle plays into it all more than we know it's important, but it's just trying to bring it together how key it is to everything. So these then, I'm going to click through if it works. I've got Yogi at the back if it doesn't work. Where is it? Oh, here it is. So here's a research-based article that I wrote for, it's called the European Occupational Safety and Health Association. So it's a bit like the HSE equivalent of the HSE. And this is a research article, which I know you won't be able to read there, but the website is called OSHWiki. And I've done the handouts, the slide presentations that all of the links will go through. So actually, if you want to just share any of this with schools, you could just send them it as a PDF or PowerPoint, and it's all there for them. So looking at risk factors, we've got lifting here, uncomfortable working positions, things that we will relate to. Again, this this vitamin D is really important. So I won't whiz through all of that, but just as a really good evidence-based article there and strategies to help at the end, looking at design, thinking about safer, healthier working environment and safer practitioner. If we target things with that mindset, we can stand a little bit more of a chance of people getting on board and understanding, hopefully so. Whoa. Might need you, Yogi. You told me not to do it in that slide thing, didn't you? I need to press this one, don't I? I just want to, I know you said don't go on that one, and I have. And then I just click through. Thank you. You're going to get your steps in. You're going to be to and fro, I think. He's noted. So some other signposting resources for you to make your life and hopefully others that little bit easier. This is some work we did together with the University of Derby, the National Education Union, the Early Years Alliance who are hosting it, and the HSE got on board. So trying to get education as a sector within HSE because it's not there yet. So again, research-based, but also clicking through what are MSDs, examples of practices, a bit about the law, not the big stick, but actually you should be looking at these and how to manage risks. So that's another one you can signpost people to. Have I done it again? You told me Alt-Tab. Is it not Alt-Tab?
Yeah.
Perhaps I'm all caps lock again.
It's show you need to go to. That one.
But it didn't give me an option. Stay there, don't go. So another signposting resource, this is by the Chartered Institute of Ergonomics and Human Factors. So thinking about setting up your workspace. This is great this is for the educators, these are. It's okay, but it's got the gist of ventilation plants, sort of, I'd change a few bits of that. But again, quick, easy advice, and it's this drip, drip, drip kind of approach. So what I'm going to do, can Alt-Tab. Get me. I don't know if any of you have heard of a little guy called Napo. Some of you have heard of Napo. So he's Europe-wide, and so he has a universal language in terms of little noises and squeaks, but really quite fun videos, all sorts of occupational safety and health videos there. And there is one about musculoskeletal disorder. There's loads of pages of that. But again, probably worth spending a little bit of time having a look at that, because you might find some other resources that are useful for the fields that you're working in. This one follows down from the MSD Early Years Alliance guidance. So a manager's checklist, looking again, healthy working environment and safer practitioner. So dividing it into those separate sections that make it just that little bit more easy to handle and navigate for those working in the field, and an action plan there. So that one is a what's it? Hang on. Oh. This one from National Education Union. So in conjunction with the HSC and Early Years Alliance, but just a different way of presenting the information. Do any of you support people that are in unions, or not necessarily? No. But just to be aware that if members you're supporting are in a union, then they can be signposted to advice there too. And this is what their unions will be advising. Couple more here. How are we doing for right time, aren't we? There's also to sort of acupuncture and what's the name of it when they do, it's the technique, Alexander technique. So he does, this chap, it's quite an interesting podcast actually if you're interested in posture and health and aspects of that. It's sort of 30 minutes long and cover all sorts. It's called Posture Stars, and we did a teacher's posture one. So it's discussing really why we think teachers' posture isn't perhaps always considered as a higher priority, and it looks at reinforcing how important staff are, and actually staff are the most important resource a school has. So again, just signpost someone to that, and also for your own interests, there's some nice whilst you're cooking tea little podcasts there. Come to. Has anyone heard of this MSK Wellbeing for Early Years Workforce course? No. So this came on from doing the Early Years Alliance HSC advice when they realised actually there was nothing out there. So we were working with one of the directors for quality improvement, and he said after about 2 weeks working with him, Lorna, I can't believe nobody's looking at this. It's so obvious. Everybody's got back pain and they're sitting on tiny chairs and they're working with children. Why is nobody doing this? And it's like, well, I've been trying for about 10 years. But, and so he's now jumped on, seen that there's obviously opportunity. So it's great that there is a course. It's free to members of the Early Years Alliance, and only £2.50 if not. So this is a cracking course if you are supporting people or even advising training. It's not a substitute for training, and actually it does advocate having practical manual handling training for early years staff. So it's almost reinforcing the need and what we're doing. Looking a bit more at anatomy, physiology, why it's important. Again, making it positive and helping teachers teach rather than the big stick, you need to be doing this, can't believe you're not approach. We've got some on the Jolly Back website, some National Back Exchange members that just are on there if people want to contact manual handling providers directly, because we were speaking to staff and nurseries and they didn't actually know where to go to even get manual handling training for early years staff advice. So we've just tried to collate some people that offer it together. So if, I don't know, do you recommend advice when you're working with people, or have they already had it? Does it depend who you're supporting? Yeah, do you recommend advice to people you're supporting if they come to you, or not necessarily in your role?
We actually provide training
as well. Okay. So yeah, so I know in Hampshire, whereabouts is it? You're not in. So I know Hampshire do that. I think Yorkshire possibly not. Say again. Do. That would be really useful to get your contact details, because it's nice. It would be nice to form a picture of who's doing what where, and also in terms of the traction and a bit more cohesive approach to this. There's still different people doing bit, and there's a lot of great work happening out there, isn't there? But it's just trying to coordinate all this together. So if you're willing to share your details, that would be really good. And then we've done some more equipment. So when I set up, I just did the Jolly Back chair, just as a going slightly mad on maternity leave with number 3. And it kind of took off as a concept. So I've been doing that, but have felt I've been too far away from my core physio love and families. So Willowbrook Education now manufacture that, and they've got a range of products like low height working equipment that they just said, Lorna, do you have any more ideas that you could make a catalogue? And I was like, yeah, I'm sure I could. So I've got catalogues there, and MBE have given permission to give those out if you want to have. So there's products in there for staff and for children. And we've just heard that some of the big catalogues, TTS and education catalogues, have seen it as a need, and are going to have it in catalogues for next year. So hopefully it won't be seen as niche and reactive. Hopefully we'll try and get some more prevention in there. We've done one without wheels, which I think we don't need one without wheels, but he said we can, and people were asking for it. So you can look through that. So before we come on to things for children, is there anything else like you wanted to discuss in terms of caseloads or advice or signposting? I need to do this one. So is it useful just going through like this in terms of signposting? Yeah, that's good. So when we did the adult article, well, actually, I was initially approached saying, would I do something for MSDs and children and young people looking at this preventative health and the future workforce? And it's then I said, can I do something for teachers as well? So this one, I guess less relevant for your working roles, but pertinent if you know children and young people. So this is cross-Europe-wide research, but the incident is quite staggering, really. 75% of 10 to 19-year-olds in one study, 64% of secondary. So, yeah, it's not great. So, again, strategies to help. I won't go through all there, but looking at the working environment and safer working practices for children. I'm thinking about school as the workplace of the child. I'm hoping one good thing of COVID might be that people do take a bit more responsibility and are more aware of the importance of health and keeping ourselves healthy. I do think that has happened a little bit, although I think we're in this crazy catch-up where everyone seems to be totally burnt out at the minute. This is only last week. Oh no, this is a different one. So this was an initiative by a company called Cardenas. You may have heard of them. They do risk and safety management globally for huge corporate companies. And this was they approached me in terms of their corporate and social responsibility. We want to do something to look at preventative health for children and young people. So they've got shed loads of cash, so it was a great resource. We could put together. And it's been endorsed by the Health and Safety Laboratory. So this, I wish every school would have this on their school website for families to access should they wish. So to access it, you just click at the bottom here, and it's like little videos and interactive things like buttons to press to get your chair the right height. There's lots of free downloads for schools at the top here, sort of advice on choosing a bag if you're in year 6 for secondary, carrying only what you need. So lots of physio practical resources looking at gaming and postures in that respect. So if you know any young people, share away, or any schools, because this doesn't collect any data. It literally is a free give and has been very well received. I think has won some awards in America for like ergonomics programs, because really there's nobody else doing this yet. And it is a really good program. I will come to that framework one after. This is the new one. Yes, so this was only the other week. So looking at home learning. So this is, I don't know if this will click through, but quite a nice little infographic here with the learning in the centre and the children, the teachers and the parents all working together, and the different aspects, again, this multifaceted aspects around the outside. Lots on here. Some better, that's not a great graphic, is it? But just starting to have the concept here of children, graphics with children, which there hasn't been that I'm aware of to date. environmental factors. So I'm thinking about school design. The school designers are getting on board in terms of not only it's more play and collaborative learning at the minute, but we're trying to get in from a health angle. And actually, if you're encouraging more play and physical activity and collaboration and movement, lighter spaces, better ventilated spaces, this is all benefiting our musculoskeletal health and well-being. So trying to get across the designers as well to have like this more core approach. And there is, if you're interested in school design and things that are coming, there's an organisation called Planning Learning Spaces, which brings together some designers across the world, and there's some fantastic designs, like slides that you can get from top to bottom. I think we're years away from that in the UK, I'll be honest, but others are starting to embrace it and then incorporating more movement and such like. Just as the adult Posture Stars podcast, we did one on children, and that was looking at physical activity, child development, how that carries through into when we become more upright and into being able to physically carry our bags okay in terms of core control and such like. So again, that might be of interest to people that perhaps prefer learning through listening than just reading things. Now, this is something that you might be interested in. The website, I will say, is dreadful, but there is a tender out to improve it. So this is the European network, but it is global. There's people from India and Egypt and Australia looking at education and training and occupational safety and health. So if anybody is interested in learning more about that, I can take emails and share information with you. Just updated the vision, and it's looking more about incorporating occupational safety and health into sustainable learning environments. So actually looking at sustainability in terms of the green aspect, but also our future generation of workers being able to feed into the workforce. So that is a good network to be part of. And they're doing stuff. They were part of the World Congress. They had a side event on Friday, actually. Wanted to go, but we were moving our eldest to uni, so that came first. But it's definitely, and all the time I've been doing this does feel the time that it is starting. But it can't be ignored any longer. I think that's probably why it's starting to happen more so in schools. And I think we need to, it may be that actually the route into protect the educators more so is through the children, because the children are always the centre, the staff don't seem to feature as much, and maybe we get this concept of ergonomics and musculoskeletal health within the children first and then into teachers, rather than from a legislation point of view and looking at the teacher into the child. I've tried both as best I can, and I'm not sure of the answer, but I think the more people that are doing different things and collaboratively working, the more impact that we will all have. I'm happy to work with anyone on this. So I'll go, I didn't do an end. So in terms of learning objectives, hopefully got a bit more awareness of the ergonomic factors related to education. I'm sure you're quite familiar with them already anyway. The latest interventions that are happening, where to go for more information, the signposting, and as I say, the slides should be easy to share rather than having to do any work to prepare to share them. Able to share practical tips, overview of future developments, and then we can discuss away. So is there anything else you would like to know? Or I was going to bring more equipment, to be honest, but I haven't managed to get more. But I've got like a beanbag we could try and a brochure, and we could just have a chat, a bit of downtime if you want, whatever it suits you at this time in the afternoon. That's this. If I was very organised, I would have put my contact details on the end, but it was a little bit last minute. As I say, I've had just really missed treating kids and didn't really want to become a furniture seller, and that's how it was going. So Willowbrook have taken on the manufacture and the marketing and the invoicing and all that. Oh, what colour shall I have? And I had a bit of free time, and then I saw this physio job at the Children's Trust come up for a brain injury specialist at Sheffield Children's Hospital, covering that area. And it sounded fascinating, like working with schools, doing education on brain injury, kids going back. So I applied thinking I probably wouldn't get it, and I did. And I've been doing that for the last 2 months. And yes, it's probably not sustainable long term. So my jolly back stuff has taken a bit of a back seat, but and I haven't even bought business cards. But if you want to get hold of me, it's just lorna@jollyback.com. And if you would like me to send you information on the Anytosh network, or certainly Oxfordshire and Nottinghamshire, that would be great, just to collate contacts, not to share or anything, but know if we've got ideas or if we're trying to bring people together, we've got somewhere to go.